I'm Dr. Sherry Tupper. I'm an internist and critical care specialist, and I work full-time as a hospitalist at the Rehabilitation Hospital of Cape and the Islands.
Before joining the medical staff at RHCI, Dr. Tupper cared for patients at Cape Cod Hospital and regularly referred her patients to RHCI.
Now that I've seen the rehabilitation process up close, I understand that there really is a difference between a rehabilitation hospital and a skilled nursing facility or nursing home. The rehabilitation hospital is a unique place to care for patients. On Cape Cod, it's the only rehabilitation hospital that offers the physician services as well as all the intensive therapy services, and is a local place for patients to go who don't want to be far from home, and to have this expertise so close is a wonderful benefit for the community.
RHCI has 7 full-time board-certified physicians whose offices are located at the hospital. Our physicians are specialists in neurology, internal medicine, and rehabilitation medicine, also known as physiatry. They treat patients with a wide array of illnesses and injuries, from stroke, brain injury, and Parkinson's disease to joint replacement, trauma, and complex medical conditions.
Other facilities do have physicians that follow their patients while they're there, but here the physicians really lead the team, are an integral part, and help in the decision-making on a daily basis to determine what's best for the patient and to lead them through the rehabilitation process.
Each patient's rehabilitation team is led by an RHCI physician and includes a nurse, physical therapist, occupational therapist, rehabilitation aide, and patient care coordinator, and of course the patient and family. Speech and respiratory therapists, social workers, psychologists, and other rehabilitation experts can join the team as needed.
Everyone works together to assure the patient's care and follow them throughout the hospital stay.
Patients are seen by an RHCI physician every 1 to 2 days. At skilled nursing facilities, physicians typically check in on their patients weekly or even monthly, depending on the facility.
The benefit of having a physician see you daily or every other day is that we're here. If a patient develops a new symptom, a new problem, we can identify it early, jump right on that, and make sure it doesn't become a problem so they can continue on rehab and on their course so they can get home as soon as they can.
And at RHCI, there is always a physician on site, 24 hours a day, 7 days a week. Skilled nursing homes do not have physicians on site 24/7.
You never know if something unexpected is going to happen at 2 o'clock in the morning. You don't have to call someone in. There's someone right here to take care of any issue that comes up, and any problem that arises is a physician readily available. At a rehabilitation hospital, as opposed to a skilled nursing facility, this is a dedicated approach among this whole team for therapy and provide intense therapy directed towards a patient's needs. By this team approach and by this intensity of therapy, the patients get stronger faster, they get better faster.
Patients at RHCI benefit from a minimum of 3 hours of therapy per day, 5 days a week, plus therapy on the weekend. We offer physical, occupational, speech, and respiratory therapies, plus therapeutic recreation. Skilled nursing facilities provide much less therapy, typically a half hour to 1.5 hours per day, but it varies greatly from facility to facility.
The therapists know their skilled area, they know how to get patients to participate in therapy, and they're flexible. They never say, oh, we can't do that. If there's a problem, they approach it from a novel perspective, and we find out as a team what we can do for that patient, and therapy gets done. The capability of the nursing staff here exceeds general nursing care. They're rehabilitation specialists. They are well trained in telemetry, which is heart monitoring. They know how to evaluate the respiratory system, care for wounds, fractures, and they really apply their expertise to this patient population, which has special needs. So their level of expertise helps round this out and make it special and different than generalized nursing they may get somewhere else.
The nursing staff at the rehabilitation hospital includes registered nurses, as well as certified rehabilitation registered nurses who have additional training in how to support the patient through the rehabilitation process. RHCI has one of the most generous nurse-to-patient ratios in the region. There is one registered nurse for every 5 to 6 patients during the day and evening, and one nurse for every 7 to 8 patients at night. Nursing homes generally have one registered nurse per unit, or per 10 to 20 patients during the day, and one nurse to cover an entire building at night. And patients and their families can feel confident that there is a physician on site days, nights, and weekends to consult with a nurse or other team members and respond to any changes in the patient's status.
We're always available to answer any questions from the nurses or therapists, but we're also available to address any concerns or questions that the family members may have.
If you have any questions, we invite you to call and arrange a convenient time to tour our beautiful hospital and learn how you or your loved one can get stronger, faster, with the help of our exceptional team of physicians, therapists, and nurses. Learn more about comparing rehabilitation options and see inspiring stories of our patients' recoveries at www.rhci.org/compare. RHCI is part of the Spaulding Rehabilitation Network.